is an incidence of 3 million lower back pain cases per year, and according to the World Health Organization, the prevalence of lower back pain is 60 to 70%. Younger adults are more likely to have pain caused by lumbar disc herniation, degenerative disc disease, or muscle and soft tissue strain. Older adults are more likely to suffer from pain related to joint degeneration, this being osteoarthritis or spinal stenosis, or from compression fracture. There are a variety of problems that can occur with the spinal muscles, nerves, bones, discs, or tendons in the lumbar spine, some of which include the nerve roots may be irritated, which would also cause pain in the legs. Smaller nerves that innervate the back may be irritated. Muscles of the erector spinae may be strained. Bones, ligaments, or joints may be damaged, or the intervertebral disc could be damaged. How is lower back pain defined, and how do patients come to you complaining of lower back pain?
So low back pain we kind of classify, is it disc pathology or more of a dysfunction? And it kind of depends on how, and how it presents. So are you getting numbness and tingling into your legs or neurological symptoms? That would lean us more towards a disc pathology, whereas a dysfunction or a SI joint dysfunction would be some sort of muscle imbalance or rotation. Usually that pain is isolated just to your back and on one side, the right or the left side. I would say we see SI joint dysfunction a lot in our active young patient population. Probably once or twice a week, I would say we get some sort of low back pain. As far as the disc pathology goes, again, that kind of depends on what sport or type of student athlete that we see. We might get 3 cases a semester of disc injury or low back pain because of a disc injury. But
what could the possible causes of a lower back pain be, and is it easy to diagnose?
It is easy to diagnose, but a lot of times physicians, especially with a disc pathology or injury, will still get diagnostic imaging so that you know how severe it is, specifically what principle of treatment that you're supposed to use or going to use, if an injection or etc. would be appropriate, or if you need some further treatment like surgery. Possible causes of low back pain, so if you have a disc injury that is protruding into your spinal cord, that can cause low back pain. With SI joint pain or dysfunction, that could be, well, are your hip flexors tight, or your hamstrings tight, or are your glutes not activating as they should be, or do you just have poor core stability, so your deep core muscles aren't actually able to stabilize your low back and your pelvis, and that can cause low back pain as well. So it is fairly easy to diagnose, but as in a cover your own butt world that we live in, a lot of people will go ahead and get the diagnostic imaging to help out.
Is lower back pain found in one population over another? I know mostly you'll see athletes, but maybe different sports.
Yeah. And the type of low back pain is different. So for football players that squat a lot, that are bent over a lot in their position in their sport, or field hockey players, we see more disc-related low back pain. In other sports like baseball with the rotation, we would see more SI joint injuries. So people that are sedentary too, you would find more disc injuries as opposed to SI joint or other low back injuries. And too, young versus old, it kind of depends. So as you know, the integrity of your bones and collagen and stuff breaks down as you get older, so they're definitely more susceptible to low back pain or injury.
How do you treat lower back pain? Is the treatment related to the severity of the pain?
It is related to the severity of the pain, and that sometimes if we're trying to treat low back pain with hip or low back mobility exercises, well, if it's painful, you can't necessarily do certain motions or do that. A lot of times the goal is to put the person in a pain-free or better position, whether we have to mobilize the hips or do an adjustment on the low back, and then activate the core with TA bracing or activate the glutes, and then from there go into the strengthening exercises, so the planks. And our idea of core stability or core rehab and treatment is different than like a strength and conditioning specialist, because we think more of the stability, all the exercises that you do when you're keeping your core in tight, whereas they would do like resisted sit-ups or hip-ups or something like that. The severity or the treatment does depend on the severity. Like, for example, if you have a herniated disc that is completely herniated, or like, you know, jelly donut, the jelly is coming down into your spinal cord and down your spine, that would require a surgery. So you'd have to repair the disc. If you have a degenerative disc disease, so that's like multiple discs, your disc height is shortened, and that can cause a lot of low back pain. That would require what's called a spinal fusion, so where you're actually fusing the two bones, the lumbar vertebrae, together.
How long does recovery typically take?
Most low back pain, I don't remember the specific percentage, but it's like 80-85% of low back pain actually goes away on its own. So whether or not we do anything about it, it will resolve on its own. We can obviously help it, you know, recover. With a side joint pain, it's like, I would give it a week essentially. For a disc injury, it's a lot longer, and it just depends on the severity of the disc injury. Are they getting symptoms under their foot, or are their symptoms only going into their glute? And if the symptoms are going into the foot, that's a longer recovery than if you're just getting symptoms into your glute or the back of your leg. For surgery, that's a several, like spinal fusion, that's a several month recovery.
Is it possible to prevent lower back pain, and if so, how can it be prevented?
It is, because a lot of low back pain could come from like at least the dysfunction. So stretching a lot, stretching the hip flexors, the hamstrings, having good core stability, so doing planks and other core exercises will help stabilize the low back. And then also, as far as disc injury goes, like not being overweight, obesity is a huge contributor to that. Not having a sedentary lifestyle, so sitting for a long period of time. So active people that are up, even just walking around, that are not overweight, you know, you can prevent it that way as well. But also, like, not doing Olympic lifts all the time can help prevent low back pain.
Interviewing Leah Mostowski. She is a hammer thrower and weight thrower on the William & Mary track and field team. So how often do you experience back pain?
I probably experience back pain, like, I don't know. I usually experience it after a heavy lift, so it really depends on where we are in our lifting cycle. Not really during or like after or during like throwing sessions that I have during practices. When I do Romanian deadlifts in the weight room at like a heavyweight percentage, and also just regular deadlifts, even front squats and back squats. But I have had a very inflamed lower back for a while. It's kind of been an issue that I've been dealing with. So.
Do you happen to experience any pain outside of lifting in the weight room, like day-to-day activities, like sitting in class or?
Sometimes definitely sitting in class. I experience it also doing like laundry or something. Maybe even like walking to class, but definitely when I'm in like a static position for a while.
All right, and how do you go about treating it?
When it's really inflamed after practice, I usually put some ice on it when I go to the athletic training room, and try to like roll it out a little bit, try to get like soft tissue work in. And if it doesn't ends up not getting any better, usually going to a trainer to ask if they can like help me release it a little bit. But like I said, I kind of like have my back is notorious for being very tight in general, especially my lower back with my particular event.
And how do the trainers help you to release it?
Um, they they try to just do like some pressure point stuff, and like try to stretch out my hamstrings, try to determine other causes of like why my lower back is getting tight. Also like releasing my glutes. So like because obviously all of those things contribute to like lower back tightness and inflammation. So.
Looking at back pain as a medical issue, it's not really considered a disease of sorts, but instead it's part of a normal experience we get from various causes. The various parts of the back involving bones, discs, ligaments, nerves, and joints all work together to help our backs function properly every day. However, sometimes these parts backfire and cause something that we know as mechanical back pain. The amount of pain someone feels doesn't always reflect the seriousness of the issue, and most cases of back pain fix themselves and get better with little to no treatment. Sometimes it persists, and for these cases, 30% have reoccurrence within 6 months, and 40% have some sort of reoccurrence within a year. With general back pain, there are two patterns that we can look at. First is back dominant pain, which radiates down the back to the butt, with most of the sensation being in the lower back, but sometimes people can feel it creeping into their upper legs. This is the type of pain that people try and get rid of by stretching out or arcing backwards or even bending forwards, and it acts up randomly and can happen in something that we call spasms. This back pain isn't considered too dangerous because there isn't any damage to the nerves or spinal cord, and so no surgery is really required for this type. The second type of pattern is leg dominant pain, which is the result of a disc problem known as sciatica. You may have heard of someone having a slip disc or a bulging disc in their back, and this is the type of pain that would relate to that. The pain can shoot down the legs, which is where the patient will feel it the most, and will oftentimes feel it constantly, regardless of the type of activity they're doing. Now usually, even in these more severe cases of back pain, it'll get better. However, this won't happen usually without the help of doctors and medication, and sometimes imaging if surgery is a potential option. Pain that doesn't last very long in the back is considered benign and almost always goes away by itself over time. However, it's important to review some of the red flags that could show us that we need to further investigate. The first red flag is a change in your bowel or bladder control or numbness in your groin or rectal area, which could mean that something is pressing on the spinal nerves in the area. The second red flag is infection, which could be described as a prolonged fever or any other issue that could cause your immune system to be weakened, leaving you vulnerable to other diseases. The third red flag would be the risk of a fracture. If your pain started after you had a big fall or were in a car accident, or even if you have brittle bones because of something like osteoporosis, this could increase the odds that your back pain is actually the result of a fracture. Fourth red flag is cancer, which is predominantly in the prostate, breast, or lung areas, which could cause back pain as well as weight loss, which is another sign. If you have these sorts of symptoms, you should definitely consult a doctor. Final red flag is diseases that cause inflammation, such as ankylosing spondylitis. Diseases like this can be seen as many as 1 in 20 people with back pain. People with this have a lot of pain during the night, as well as the morning stiffness. This does get better with movement, and it occurs most often in people ages 15 to 35 years old. People's attitudes towards back pain is a crucial part of them getting better. The issue is that people think they have a back illness, so they should consequently stop exercising. They also might think every time they feel pain, they suddenly have the illness again. Looking at the next 4 yellow flags, these predict whether or not someone's back pain will become chronic. The first flag is the belief that back pain is harmful and disabling. And the second yellow flag is the fear of activity and the avoidance of activity to prevent further damage. These two beliefs were debunked in a study involving airport workers in the Netherlands. The study used workers who had experienced back pain or back injuries that had put them out of work for over a month. Of all the workers, they were divided into two groups. The first group with severe back pain received the usual care without any additional exercise. The second group received the same care but were slowly exposed to more and more exercise over time, and they were also conditioned to think that they could function normally despite their back issues. Making them believe this debunked flag number 1 because they realized they could function and that it wasn't too harmful for them. This opened up the debunking of flag number 2 because since they didn't think it was harmful, it no longer affected their fear of activity and movement. It just shows that sometimes it's mind over matter. The third yellow flag is a tendency towards low mood and isolation. The fourth flag is the belief that passive treatment instead of active treatments will help. Some people think that you just need to sit there and have someone work on you, when in reality, you have to do some of the work yourself. The big question is now, what should you do? Most people up until the late 1990s thought that you should stay in bed or rest. However, now we know that oftentimes it makes the issue worse. If you have more severe sciatica, it may be good for you, but for most cases, this does not help. Generally, the people who move less are worse off. Motion and physical activity go a long way, combined with over-the-counter medications that help to reduce pain, which helps keep you moving. There are some other treatments also that have proven to have effectiveness with back pain. Some are spinal manipulation, typically by a chiropractor. Massages also help a lot with the surrounding muscles, and even acupuncture to help relieve stress. Treatments like these are considered active therapies. Once your pain is reduced, activities like Pilates or yoga could help to improve core and trunk strength, which consequently could help keep the back pain away longer. The active therapies treatments shouldn't be done forever, and most patients report going to these types of treatments for 8 to 10 sessions before stopping. If these don't work at first, it's not very likely that continuing to go is going to help either. Other approaches are cognitive behavioral therapy and having a team of people to help you with different sorts of treatments. Back problems are often complex, and we know that complex problems are rarely resolved by doing one thing or looking at one place in the body. It's a combination of things, and that's why developing a team of people really helps.